As you know, it's important to me that the supplements I recommend and use are of the highest quality. That's why I stock the Protocol for Life Balance product line at my online dispensary, drhoffman.com/Protocol for Life Balance. Protocol for Life Balance offers a wide range of professional-grade products using ingredients backed by strong scientific research, including a suite of supplements specifically designed to support neurological health and cognition: Coggumin SLCP, Magtine, phosphatidylserine, and Brain Regain. Coggumin SLPC is curcumin optimized to penetrate the blood-brain barrier, where it helps protect brain tissue. Magtine may support healthy cognitive function, learning, and memory. Phosphatidylserine supports neuronal membrane fluidity, promoting cognitive function and mental acuity. And Brain Regain is a broadly useful herbal health aid that may be advantageous for supporting healthy cognitive performance. For more information and to order, just go to drhoffman.com/Protocol for Life Balance. That's drhoffman.com/Protocol for Life Balance. Protocol for Life Balance is an A-rated GMP manufacturer of premium dietary supplements.
Welcome to Intelligent Medicine, America's foremost program on health, medicine, and nutrition, featuring the latest on both conventional and alternative therapies. Now, here's Dr. Ronald Hoffman.
Welcome to Intelligent Medicine. I'm your host, Dr. Ronald Hoffman. We're a radio show. We're also a podcast. You can hear us across many stations across the United States, as well as in parts of Canada. And also, this program becomes a podcast after the weekend. It's usually a weekend program. And you can call in. It is participative. 877-726-8255 is our number. When you call, you'll be prompted to record a question or comment, and then we'll take it up on a future edition of Intelligent Medicine. We've got lots to talk about this weekend. We're going to talk about the transition from daylight savings time to standard time. We've got some interesting stories about vitamin D and omega-3 fish oils, as well as a bunch of your questions. 877-726-8255 is our number. And we'll start with one of your questions because it's a thought-provoking one. So let's hear it.
Dr. Hoffman, could you please share your knowledge of TSW, Topical Steroid Withdrawal? I've suffered with eczema since the age of 3 months and used cortisone creams and prednisones off and on for many years. I'm now 70 years old, and I have a new type of rash that does not resemble eczema. It's much worse and debilitating and matches the description of the disease called TSW.
Okay, so yeah, in medicine we love acronyms. So TSW stands for Topical Steroid Withdrawal. And what happens is if you have eczema, which is an inflammatory skin condition, the skin gets really red and itchy and flaky, and sometimes people's entire bodies are covered with eczema and they look like a boiled lobster. It's devastating, very uncomfortable, and it can, as you suggest, it can start in infancy. And the initial treatment for it, and a traditional treatment, is topical steroids. And you can start with the light ones, even, the over-the-counter ones can help, but they don't do much good for more severe cases of eczema. And then you can escalate the intensity of the steroids until you get to very potent steroids. And what they do is they turn down the volume on inflammation. And they do a pretty good job, but they have some side effects, which, by virtue of the fact that the skin is thin, especially in children have thinner skin than adults, and females actually have thinner skin than males, there's a fair amount of absorption of some of these powerful steroids. And so you can get systemic side effects. They can suppress the body's natural production of cortisol. You can get Addison's disease, which is an inability to produce your own steroids if you stop using the topical steroids. You can develop Cushing's syndrome, with a moon face and high blood pressure. This often happens when people take oral steroids, but it can happen when you take topical. You can get eye problems. You can get glaucoma or cataracts. Long-term use of topical steroids can increase the risk of eye problems. High blood sugar. Well, we know that if you take oral steroids, your blood sugar rises, and your blood sugar may rise a little bit if you take topical steroids because you're applying lots of stuff to large surface areas of your body, and they're potent, they get absorbed, and they can increase your blood sugar. And in children are particularly susceptible to growth suppression from systemic absorption of topical steroids. And women in particular can get decreased bone density. All these things have been proven in studies. So the idea is get off the steroids as soon as possible, but people become hooked on the steroids. And when they stop, they get TSW, topical steroid withdrawal. And as with many types of withdrawal, for example, withdrawal from acid blocking medications, you get rebound. In the case of acid blocking medications, you get hyperacidity. And when you stop topical steroids for skin, you may get rebound inflammation. So it's very hard to get off. And as a result, they've come up with alternative drugs, so-called biologic drugs. One of them is tacrolimus, brand name Protopic. It's an immunosuppressive medication that's non-steroidal, and they've got a whole bunch of biologic injectable medications. You actually see sometimes ads for these on TV. People are unhappy with their skin conditions. They're embarrassed to, go in the pool or go to the beach. And then they take these injectable medications with strange names: Ebglyss, Nemluvia, Vitama, Anzupco, Cibinco, Adbry. These are some of the new injectable steroids medications, but they have side effects. Tacrolimus is very expensive. You're hit with a big copay when you get a little tube of tacrolimus. And these other medications, because they suppress your immunity systemically, they can increase your risk for respiratory infections or other types of infections, even cancers. So, what's the answer? Are there natural approaches to eczema? Well, start early in life because early life exposure to antibiotics increases the risk of eczema, according to a systemic review. They concluded that exposure to antibiotics, especially in the first year of life, is more common in children with eczema. There was what is called a dose-response association. There was a 7% increase in the risk of eczema for each additional antibiotic course received during the first year of life. And so breastfeeding may confer protection against eczema, but some moms notice that when they're breastfeeding, their babies or toddlers still have eczema, and by virtue of elimination of certain foods, maybe elimination of dairy. The dairy antigens are transmitted via the breast milk, and the baby becomes allergic. And sometimes the mom going on a elimination diet can help a child's eczema if they're breastfeeding. So what can you do to ease withdrawal from steroids, this TSW syndrome, topical steroid withdrawal syndrome? Well, elimination diets help. Anti-inflammatory diets help. And by eliminating certain foods that you might be allergic to, typical culprits include wheat, dairy, eggs sometimes. That can help in certain instances, although different strokes for different folks. But an anti-inflammatory diet, a low-sugar diet, a diet without preservatives, that can be very helpful, as it is for many inflammatory conditions. Supplements for eczema, probiotics have been shown in some studies to be helpful. Vitamin D, especially helpful because it's an immune modulator. It helps with autoimmune diseases, as we'll hear about soon in a story that I'll share with you later. but it also helps regulate the immune response in the skin. Fish oil can have anti-inflammatory properties, so take lots of fish oil. Vitamin E may reduce eczema severity, and zinc. Zinc deficiency, in kids with zinc deficiency in certain parts of the third world, it's kind of hard to be really zinc deficient here in the United States, but kids with zinc deficiency look like they have eczema. Their skin is flaky and red. Evening primrose oil or borage oil. These contain GLA, gamma-linolenic acid, which is a fatty acid that helps to moisturize the skin. And in some cases, vitamin C, B vitamins, even melatonin have beneficial effects. So consider those approaches. There's actually some novel research, not big studies, but some small studies that suggest that traditional Chinese medicine therapy can be helpful for steroid withdrawal. Here's one. We recently showed that multi-component traditional Chinese medicine had steroid-sparing effects in moderate to severe eczema. And it's a small series of patients. They used a formula. And by the way, it's tough to find someone who is really reputable to offer you the right kind of TCM, traditional Chinese medicine, that is the bona fide, scientifically proven form of TCM to address your concerns. So, just buying an over-the-counter formula or going down to Chinatown, grabbing a remedy, or, buying something off Amazon isn't necessarily going to fix your problem. But working with an expert traditional Chinese medicine practitioner, even acupuncture, in some studies has been shown to affect the immune system and reduce the severity of inflammatory disorders of the skin. So there you have it. There's some off-ramps to this, but it may take substitution of another medication to allow you to take less steroids to reduce the rebound. And, you with a lifetime of eczema and topical steroids damage the skin, you've developed yet another skin problem. So it's best to avoid dependency on steroids because they thin the skin, damage the skin immune system long term, and are just kind of a Band-Aid approach. 877-726-8255 is our number. I'm Dr. Ronald Hoffman, and this is Intelligent Medicine. If you've followed my work, you know that I consider omega-3 fish oil to be an indispensable part of my daily regimen, and that I've recommended it for my patients and followers for decades. If you're already taking omega-3s, you should know that I've discovered a product so special that it's become my go-to brand. Dr. Jeffrey Bland, one of the luminaries in the world of complementary health, takes omega-3s to a new level. Omega-3 Rejuvenate from Big Bold Health is a premium blend of pure oils from wild-caught Alaskan cod and sockeye salmon, sourced from the pristine waters of Alaska. Unlike most other brands, Omega-3 Rejuvenate does it differently. The product comes straight from the sea into the hands of skilled fishermen, instantly flash frozen, and taken to their specially designed shoreside plant using a low-heat technique to extract the pure amber omega oil that contains all natural and abundant full-spectrum omega-3s, including EPA, DHA, as well as DPA, plus all natural vitamins A and D, and naturally occurring pro-resolving mediators to support cardiovascular, cognitive, and immune health. Their unique process preserves the natural goodness of the fish, so you get maximum benefits in every soft gel. No fillers, no shortcuts, just pure, potent wellness. Visit bigboldhealth.com/Hoffman and experience the difference. That's bigboldhealth.com/Hoffman for Omega-3 Rejuvenate. Use coupon code Hoffman20 for 20% off site-wide. If your quest for longevity feels overwhelming, here's some good news. It starts with one simple daily habit. MitoPure gummies from Timeline. They're the first ever longevity gummies that ignite mitophagy, your body's natural anti-aging pathway. MitoPure is a clinically validated solution backed by over 15 years of research. MitoPure gummies utilize a powerful compound that redefines what's possible for your longevity. MitoPure produces the first ever urolithin A gummies that support your cellular energy so you feel strong, clear, and vibrant. Boost your cellular energy and enhance muscle strength and endurance, all without changing your diet or exercise routine. As someone who loves to stay active, I've noticed a significant boost in my workouts since I started using it. I feel stronger and more energized, and my recovery time has improved dramatically. Better recovery starts at the cellular level. For more information and to order, just go to timeline.com/Hoffman. Use coupon code Hoffman at checkout for 20% off. That's timeline.com/Hoffman for 20% off MitoPure gummies with code Hoffman.
Subscribe to the Intelligent Medicine Podcast, updated several times weekly. Go to drhoffman.com.
Welcome back to Intelligent Medicine. I'm Dr. Ronald Hoffman. We were talking just earlier about the benefits of omega-3 fatty acid supplementation and vitamin D supplementation for eczema. Here's an article about the use of that combination, either one or another of these things or both together, in the treatment and prevention of autoimmune disease. And that encompasses a lot of different conditions. Psoriasis is considered autoimmune, multiple sclerosis, ulcerative colitis, rheumatoid arthritis, lupus. It runs the gamut. You can virtually every organ, autoimmune thyroiditis, can be affected by autoimmunity. So they wanted to investigate whether vitamin D or long-chain omega-3 fatty acids reduced autoimmune disease risk. They looked at over 25,000 participants, and what they found is that vitamin D, 2,000 IUs per day, or omega-3 fatty acids, just 1,000 milligrams per day, that's not hard to take, were associated with a reduction in the risk of autoimmune disease. Vitamin D supplementation for 5 years with or without omega-3 fatty acids reduced autoimmune disease by 22%, while omega-3 fatty acid supplementation with or without vitamin D reduced the autoimmune disease rate by 15%. So there you have it. If you're at risk of an autoimmune disease or suffering from one, it behooves you to take both of these nutrients. And when it comes to omega-3s, well, here's my newly discovered favorite brand. If you followed my work, you know that I'd consider omega-3 fish oil to be an indispensable part of my daily regimen, and that I've recommended it for my patients and followers for decades. And if you're already taking omega-3s, you should know that I've discovered a product so special it's become my go-to brand. Dr. Jeffrey Bland, who you've heard here on Intelligent Medicine, who's one of the luminaries in the world of complementary health, takes omega-3s to a new level with Omega-3 Rejuvenate from Big Bold Health. It's a premium blend of pure oils from wild-caught Alaskan cod and sockeye salmon. It's sourced from the pristine waters of Alaska. And unlike most other brands, Omega-3 Rejuvenate does it differently. The product comes straight from the sea into the hands of skilled fishermen, instantly flash frozen and taken to their specially designed shoreside plant, using a low-heat technique to extract the pure amber omega oil. You can see, it looks different, that contains all natural and abundant full-spectrum omega-3s, including EPA, DHA, DPA, plus all naturals, vitamin A and D, and naturally occurring pro-resolving mediators to support cardiovascular, cognitive, and immune health. This unique process preserves the natural goodness of the fish, so you get maximum benefits in every soft gel. No fillers, no shortcuts, just pure, potent wellness. Visit bigboldhealth.com/Hoffman and experience the difference. That's bigboldhealth.com/Hoffman for Omega-3 Rejuvenate, and please use coupon code Hoffman20 for 20% off site-wide. All right, here's an interesting study, because I sometimes ask myself, omega-3s are fat-soluble vitamins, and are their effects long-lasting or short-acting? And from a practical standpoint, it could be that before surgery or procedure, you may want to stop the blood-thinning effects of the omega-3. How many days before would you do that? For me, it's a practical question. Before I go diving, I get nosebleeds. How long before that should I stop? According to a recent study, it turns out that EPA, when you take it, it causes a sharp rise in its concentration. However, the levels decline quickly once supplementation stops. And so if you're considering stopping, it may suffice to stop the omega-3s maybe, just a few days, maybe 3 days before your procedure, in my case. before I go diving, where the pressure changes can sometimes cause me to get a nosebleed. 877-726-8255 is our number, and this is Intelligent Medicine.
Now, more than ever, it is important to have a healthy immune system. Many health professionals agree that probiotics are a leading natural therapy for boosting immune health. Why? Because 70% of your body's immune cells reside in the GI tract. By taking a superior probiotic daily, like Dr. Ohhira's probiotics, you can enhance your overall immune system and immune response. The key to Dr. Ohhira's success is the 500-plus postbiotic metabolites that are in each capsule. Postbiotic metabolites are important to the regulation of most systems in our body. For a short-term immune boost, try Dr. Ohhira's Propolis Plus. Merging nature and science, Dr. Ohhira's Propolis Plus combines Brazilian green propolis, vitamin E, astaxanthin, and tocotrienols for additional and powerful immune support. Be proactive about your immune health. Ask your retailer today about Dr. Ohhira's probiotics and Dr. Ohhira's Propolis Plus today. Also available online.
Kids don't just bring home homework, they bring home germs. And those germs don't just stay with them, they spread to the whole household. That's why Xlear nasal spray was created by a practicing physician to give parents and grandparents peace of mind. You may not think about it, but your nose is filtering out a semi-truck full of air every single day. Xlear isn't just another spray. It creates an additional layer of protection in your nose that blocks bacteria and viruses before they can even take hold. Yes, even that virus. Supporting your body's defenses right where germs first try to enter. Xlear is a hygiene product recommended for daily use, drug-free, non-drowsy, and safe for all ages. Just a quick spray in the morning and evening helps you cleanse your nose. Don't just hope for protection, create it. Get Xlear nasal spray, your daily defense. Xlear nasal spray is available at retailers nationwide and online. Check out xlear.com for our special offers. That's xlear.com.
Subscribe to the Intelligent Medicine Podcast, updated several times weekly. Go to drhoffman.com.
Welcome back to Intelligent Medicine. Dr. Ronald Hoffman here. Our number is 877-726-8255. Anytime you have a concern, or maybe you heard something on this program that you want to ask me more about, or maybe you have a comment about some of the things I've said, you're welcome to call 877-726-8255 and record your question, which we will address on a future edition. So this is the weekend where we transition to daylight savings time. And there's a lot of controversy about daylight savings time. A lot of people say they just want permanent daylight savings time because they hate the gloom of those early sundowns, especially in northern parts of the country. It starts to get dark at 4:30. And people have seasonal affective disorder. Then there are those, and I'm among them, early risers who say, I'm getting sick and tired of daylight savings time because daylight savings time was great in July. We had longer days and it was light in the morning. But because of the time shift, it doesn't get light until 7 or 8 o'clock, and it's getting worse and worse. And this morning was a cloudy day here in New York City, where I reside. Kind of a gloomy day, rainy, cloudy. And I had a date with my personal trainer at 8 o'clock in the morning, which I'm usually fine for. But I was luxuriating in bed. And finally I woke up and I looked at the clock and it was like 7:20. And I had just 40 minutes to get myself ready for a rigorous workout. And I said, this is getting nuts. I'm glad it's finally going to be the end of daylight savings time. We're shifting spring forward, fall back. That gives us an extra hour of sleep. And marathon runners here in New York, the classic New York Marathon with tens of thousands of participants, they're going to get an extra hour of sleep because they got to get up real early to get to the starting line. So part of the knock on daylight savings time is they say that it's hazardous to our health. And we know that when we disrupt our circadian rhythm, people who are shift workers, people who are road warriors and have to travel a lot. It's not healthy. The disruption of our internal rhythms can have a harmful effect on our appetite, on our metabolism, and even on our hearts. And there are doctors who swear, and I used to be one among them, who swear that they don't want to be in the emergency room on the morning after a time change because there's going to be more havoc. There's going to be more traffic accidents because people lose sleep and they're less alert. This is usually in the spring more than the fall where you gain an hour. And there's going to be more heart attacks because people are stressed. They have an hour less of sleep and their bodies are not used to it. And so here's an article which attempts to shed light on the real deal risks associated with transition to daylight savings time. Headline, daylight savings time may not trigger heart attacks after all, study finds. New studies suggest heart health may depend more on long-term sleep habits than merely the 1 hour time change. And so how big was this study? In a sweeping analysis of nearly 170,000 patients over a decade, researchers at Duke University School of Medicine found no significant increase in heart attacks during the weeks surrounding daylight savings time transitions, neither in spring nor in fall. So what they did say was there was one exception, because this is a long-term study. They did it, did it over a long time period, 10 years. The one exception in the new study was a spike in acute myocardial infarction cases following spring daylight savings time in 2020. Why was it different in 2020? I mean, you lose an hour in 2018, 2019, then in 2020, and then 2021. But only in 2020 was there a spike in heart attacks. Well, think back on what was happening in spring of 2020. Yes, folks, it seems like it's far back in the rearview mirror, but that was the onset of COVID, a period of widespread stress, uncertainty, and disruptions to health care. So it could be that around that time people were stressed, or maybe people, were tempted to ignore certain symptoms and not go to the emergency room in time because hospitals were crammed with COVID-19 patients. It's unclear precisely what was going on. But that was the year where there was indeed a spike in the spring transition. But the rest of the time, no biggie when it comes to heart attacks. The researchers still caution that sleep remains a critical factor in heart health, and poor sleep and extremes in sleep duration, less than 6 or more than 9 hours, have been consistently linked to increased cardiovascular risk. And it's also not, this whole notion of catch-up sleep, where you have sleep deprivation during the week. You have what's called social jet lag. You're just trying to do all this stuff, cram all of it in. People with jobs and long commutes, and then they try to have a social life. They stay up late, or they get caught up in Netflix, or, watching late night TV. And they scrimp on sleep during the week, but then they do catch up sleep on during the weekend. It doesn't help, folks. Your circadian rhythm should be regular. It really is, as Ben Franklin once said, early to bed, early to rise makes a man or woman healthy, wealthy, and wise. Folks, as you know, it's important to me that the supplements I recommend and use are of the highest quality. And that's why I stock the Protocol for Life Balance product line at my online dispensary, drhoffman.com/Protocol for Life Balance. Protocol for Life Balance is a great brand. They offer a wide range of professional grade products using ingredients backed by strong scientific research. And this month, they're featuring a suite of supplements specifically designed to support women's health. Myo-inositol powder, progesterone cream, as well as D-mannose capsules and powder. Minocyl powder supports healthy ovarian function. Progesterone cream supports a healthy skin appearance. It's natural progesterone. And D-mannose helps to maintain normal urinary tract health. It's great for preventing urinary tract infections. For more information and to learn about other Protocol for Life Balance products that support women's health, just go to dearhoffman.com/Protocol for Life Balance. That's dearhoffman.com/Protocol for Life Balance. Protocol for Life Balance is an A-rated GMP manufacturer of premium dietary supplements, and I prescribe them and use them myself all the time. This item has to do with step counts. And, we've heard so much about, the 10,000 step a day thing. How many steps a day does it take to prevent heart disease or alternatively to live longer? And one of the problems with these studies is that if you are in really crappy shape, you're not going to walk a lot. So you're not going to, or say you have really bad knee pain or really bad hip pain or really bad foot pain, or if you've got, a lot of shortness of breath, you're going to be a sicker person, and you're going to walk less, and hence statistically your risk of dying or having a heart problem is going to increase. So these are mostly observational studies. In other words, they look at the amount that people walk, and they say the people who walk, they don't have as much heart disease and they live longer. But it could be that they're simply healthier to begin with. But there's a new study that looks at this. Headline, it's not just about hitting daily step counts, study suggests. For older women, bunching steps on just a few days was tied to lower heart and death risks. So it says that you don't necessarily have to do 10,000 steps per day. That's a lot. Sometimes I walk in and I'll say, oh my goodness, I did 12,000 steps today, but that's the exception. It's hard to, especially you get older, it's hard to do that many steps. It takes a long time. You're slower. A large study suggested that older women who took at least 4,000 steps 1 to 2 days per week had lower risk of death and heart disease. Participants who reached that threshold 3 or more days per week, get this, had a 40% lower mortality risk. Now, it still holds that they may be healthier to begin with, so they're able to do that, right? Because if you're debilitated, you won't be able to walk, and hence by virtue of being debilitated, you're at higher risk. It's not because you didn't walk. And it's hard to tell someone who has extreme hip pain, knee pain, or is really poorly conditioned, like, okay, you got to walk. You got to walk like, thousands of steps per day. They're just not going to be able to do it. But to me, the take-home message from a study like this is why it might be a good idea if you're experiencing lots of knee pain or lots of hip pain and you've been told you're bone on bone, and some people are reluctant to undergo the surgery. They're afraid of the surgery. I tell patients, get the surgery, because not only is it going to make you happier when you're free of pain and you can resume activities, it could make you live longer. Okay? So this actually underscores why if you are limited in your ability to walk and there is an available fix, and many people rave about the results from their knee replacement or their hip replacement, they get a whole new lease on life. Get it done. Get it done early enough so that you can garner the benefits. If you're 68 or 74, you got many more years of life where you can train and walk and enjoy the benefits in terms of up to 40% lower mortality risk from your daily exercise. It can provide you with a whole new lease on life. 877-726-8255 is our number. I'm Dr. Ronald Hoffman, and this is Intelligent Medicine.
You're listening to Intelligent Medicine, a resource to help you take control of your health. We offer a balanced, objective analysis of all your health, wellness, and aging options, both conventional and alternative. Now you can take your engagement to the next level by joining FullScript. FullScript is my online dispensing platform that only offers curated, professional-grade supplement brands that I know and trust. Never counterfeit or expired, always stored and shipped correctly. Just go to drhoffmanstore.com for more information and to start your free FullScript account. Buying through FullScript offers fast, free shipping, optional refill reminders, a mobile-friendly site. It's safe, secure, and HIPAA compliant and offers world-class support. Just go to drhoffmanstore.com. You'll get access to the supplements and features you need to help you achieve your wellness goals, including my custom targeted protocols that combine the products I recommend to address specific needs, heart health, immune support, and much more. It's all at drhoffmanstore.com. drhoffmanstore.com. As you know, it's important to me that the supplements I recommend and use are of the highest quality. That's why I stock the Protocol for Life Balance product line at my online dispensary, drhoffman.com/Protocol for Life Balance. Protocol for Life Balance offers a wide range of professional-grade products using ingredients backed by strong scientific research, including a suite of supplements specifically designed to support neurological health and cognition: Coggumin SLCP, Magtine, phosphatidylserine, and Brain Regain. Coggumin SLPC is curcumin optimized to penetrate the blood-brain barrier where it helps protect brain tissue. Magtine may support healthy cognitive function, learning, and memory. Phosphatidylserine supports neuronal membrane fluidity, promoting cognitive function and mental acuity. And Brain Regain is a broadly useful herbal health aid that may be advantageous for supporting healthy cognitive performance. For more information and to order, just go to drhoffman.com/Protocol for Life Balance. That's drhoffman.com/Protocol for Life Balance. Protocol for Life Balance is an A-rated GMP manufacturer of premium dietary supplements.
drhoffman.com, your portal for cutting-edge information on health and nutrition.
Welcome back to Intelligent Medicine. Dr. Ronald Hoffman here. Our number is 877-726-8255. And we take calls every week, so let's hear one of them.
My sister has been diagnosed with neuropathy, and I'm wondering if there is a natural remedy that can help her with the pain in her feet and her head.
Okay. Neuropathy. I mean, there's a lot of different forms of neuropathy. One of the most common is diabetic neuropathy, and it's caused by long-term exposure to elevated blood sugar. It damages the nerves. But there's also autoimmune neuropathy, and that also can be addressed by, actually there's some new medications that suppress the immune system, but as we mentioned, autoimmunity is helped by high-dose omega-3 and vitamin D. But when it comes to diabetic neuropathy, the nutrients that can be helpful include alpha-lipoic acid, also vitamin B1. B1 at high doses can be helpful for that. Occasionally, that gets mixed in with B12 deficiency, so oral B12 or B12 shots can be helpful for neuropathy. And acetyl L-carnitine can sometimes be helpful for diabetic neuropathy. So those are some of the things that can be helpful. And there's actually diabetic neuropathy, I think, responds more promptly to nutritional intervention than autoimmune or what's called idiopathic neuropathy, where there's no clear-cut cause. Also, when it comes to neuropathic pain, neuropathic pain to some extent is pain in the brain. And pain in the brain responds to something called PEA, palmitoyl ethanolamide, or PEA, is a supplement that's been fairly recently introduced. It's part of the relief formula that's offered by one of our good sponsors, CV Sciences, plus CBDoil.com is their website. And relief contains PEA. You can also take PEA separately. It's a cannabinoid. And in studies, it's actually been shown to be helpful for nerve pain, which is one of the most difficult types of pain to deal with. Nerve pain is not helped very much by nonsteroidal anti-inflammatory drugs like ibuprofen, Motrin, etc. It's not helped very much by Tylenol. It's a specific type of pain. It's not an inflammatory type of pain. And PEA seems to work directly on the nerves in a way to kind of take down the volume on pain. Not instantaneously. It's not like, take a Advil and your pain goes away within hours. It's something that you take over a period of weeks or months, and is actually one of the favorite treatments recommended by our good colleague, Dr. Jacob Teitelbaum, who's a frequent guest here on Intelligent Medicine podcasts. Also pregnenolone, which is an over-the-counter supplement. It's similar in some ways to DHEA, but it works higher up in the steroid chain. It's a neurosteroid, works on the brain. And in studies, pregnenolone can be helpful for neuropathic pain, nerve pain, which can be challenging to treat. So there you have it. The study here, palmitoyl ethanolamide, that's a tongue twister, is emerging as a promising therapeutic agent for neuropathic and other pain-related conditions. And what they have found is they're trying to increase its bioavailability because its absorption is limited. So sometimes you have to find the right formulation that is actually going to be bioavailable and taken up and get to where it needs to work in your brain and in your nerves. This item, and it's a terrible scenario, is imagine going to the hospital, and it's kind of random. You get roommates, right? And sometimes you get a lousy roommate in a hospital. Cynthia Van, age 55, had been checked into Lincoln Hospital in the Bronx. I know Lincoln Hospital in the Bronx. It's, part of catch basin for some of the poor areas of New York, for an underlying medical condition. When she was punched in the head multiple times at around 3 a.m., according to the NYPD, her roommate beat her to death. A Bronx woman was beaten to death in the hospital room she shared with an emotionally disturbed patient with a history of attacking people in the hospital, according to police and law enforcement sources. So this roommate, Raquel Houghton, age 44, allegedly beat Van while she was asleep in her bed. The victim woke up to repeated punches to the head and ultimately had to be sent to the ICU before succumbing to her injuries. She died of blunt force trauma, and the incident was deemed a homicide. So bad pairing of a violent, assaultive roommate with another vulnerable, sick person at Lincoln Hospital. The suspect had allegedly already attacked a nurse in the hospital in July and assaulted a patient care associate the day after the fatal beating. So, hey, yikes. A lot of havoc can occur sometimes in hospitals. I'm Dr. Ronald Hoffman, 877-726-8255. Get ready for some more of your phone calls plus more features. This is Intelligent Medicine.